think it is written in quantum dimension that my presentation will be the last one. And at least people who are sleeping, please wake up. Let's have an exciting session on the quantum cardiovascular medicine. I'll try to finish it up in 10 minutes, and all the students, I hope you're ready for the quiz as well. So the topic is quantum cardiovascular medicine, and this session would stay as a primer. The smallest particles are going to solve the biggest cardiovascular problems. So I'll just try to go through the general understanding of the topic and then speak about role of quantum computing in different domains of medicine. And then we'll speak about few limitations of quantum computing. So the goal of the presentation is not to speak about science fiction, but to prime you that this is going to be the future clinic. We all know that there has been recent start of construction of Quantum Valley in Amravati by the collaboration of IBM and TCS, and there they are going to put a 133 qubit IBM Heron processor. What this means, probably you'll understand by the end of the presentation. So we all have gone through leaps and bounds. Initial days were those where abacus was used for computing, then the Turing machine came, and then the Enigma. These were the ones where ciphers and symbols were used. But later on in 1954, Pradic machine, which was the first classical computer which used bits, came. Bits are nothing but zeros and ones. These used logic gates where and, or, and not are used, and they used certain sort of logic known as Boolean's logic, by which you are able to come to a reasonable conclusion from the whatever problem which was given to you. From there, we all know, now I'm catching a laptop which is in the size of just my hand. So the initial machine, as you can see, was of the size of a room. The same thing is going to happen for quantum computers as well. But there is a problem with the classical computers, and that's why we have the need of quantum computing. See, there is something called precision medicine paradox. We all know that we have multi-omic data now. We have data from all the variables and everything, where the data is going astronomically huge. But the classical computer have their own ceiling capacity. This results in an insight gap. This gap needs to be filled up to know better or to improve ourselves in the field of medicine or in other fields as well. There comes the role of quantum computing. This precision medicine and quantum computing are running parallelly till now, and probably this is the time of convergence, and in the future both are going to club together, and we are going to see a huge revolution in the field of cardiovascular medicine as well as other fields of medicine. So first things first, when I was given this topic, I just wanted to know what the difference between artificial intelligence and quantum computing is. Artificial intelligence just makes your computer think better, think like human. It uses pattern recognition and helps us in making decisions. It's just like your iPhone facial recognition, where your iPhone recognizes your face and unlocks the phone. Similarly, chatbot, a ChatGPT chatbot helps us in knowing an answer to a question. But quantum computer is totally altogether a different thing. It's probably, in our terms, it might be a super powerful computer. It solves very, very complex problems which normal classical computers cannot. As of now, it's still experimental, but in the future, it is going to be something which everyone will use it. So the thing is, AI makes the computer smarter, but quantum computing is going to make your computers faster. AI determines what decision you need to make, whereas quantum computer determines how fast you can execute it. So just 2 slides about the physics which you need to know when you're speaking of quantum computing. As I've said, classical computer depends on bits, which is zeros and ones, whereas quantum computer uses qubits, which is quantum bits. To understand this, you need to know certain limits of your classical computer. As I told you, classical computer is a bit, which is zeros or ones. It's like a light switch. It's either on or off. It cannot be both together. So if you want to model a drug which binds to a receptor, it will check each one of the orientation one after the other. This is going to be a linear thing, and it's going to take a lot of time and energy and space. But the quantum nature is different, that it will do it all together. So that there comes the quantum advantage. As I told you, qubits are the ones which we use. So unlike a switch which is on and off, it's like a spinning coin. So while the coin is spinning, it can be both head and tail before it drops and comes to a stable position. So since this qubit stays in superposition, it can check all possible orientations at once simultaneously. If you think about clinically, instead of checking one drug orientation at a time, it checks all drug orientations simultaneously. Similarly, there's one more property called entanglement, where one qubit, if one qubit is there in India and the other qubit is in, say, US, both the qubits are entangled. So something changes in this qubit, the other qubit also changes its orientation. Like if you think it clinically, if there is a gene A which mutates, so if it is causing downstream changes in C, D, E, and F, so by checking orientation of A by quantum computing, you'll be able to identify what is happening to the downstream genes as well. So classical computers read one book at a time in a library, whereas quantum computer reads all books together parallelly. That's what makes it exponential. So just going into the clinical aspects of it, so the most important part is diagnostics. In diagnostics, in the field of oncology, there has been much role in mammogram, lung cancer detection, as well as prostate cancer detection. It was found to be much more sensitive and specific than the classical computers and artificial intelligence. When it comes to cardiovascular medicine, one thing which is already being used in research is the magnetic fields or the magnetocardiogram. We all know about ECGs. ECG has been there for hundreds of years and it picks up the electrical signals of your heart. But quantum computer will be able to pick up your magnetic field of the heart. One might be wondering whether heart also has a magnetic field. Yes. Anywhere where the current flows, there will be created a magnetic field by Murphy's law. So this magnetic field can be detected early, and the detection level is so sensitive that it can pick up 10 to the power of minus 15 Tesla, which is femtotesla. So this is something which is coming up in a huge way. There has been a study on this also known as MAGMA study. So you have quantum sensors which are known as squids. Squids are the ones, just think it, you don't need to know the physics of it, because just like an iPhone, we don't know what is inside the iPhone, but you use the applications of it. Similarly, there are certain quantum sensors known as squids, which are superconducting quantum interference devices, which picks up the magnetic field at such a sensitive level that when a patient who is having suspected inflammatory cardiomyopathy, MCG was able to pick up this inflammatory cardiomyopathy much more sensitive way and the specific way with more than 90% positive and negative predictive value. And when it was compared with the endomyocardial biopsy as well, there has been a tremendous gain of utility of the same. And just imagine, you walk into a room and you get a 60-second scan and you are able to say whether this patient will get MI, whether this patient has inflammatory cardiomyopathy, without even having anything else, is going to be a revolutionary thing and a game changer in the future. The same thing as discussed previously. I'll go quickly. So this is the squid which I was saying, but the problem with squid is it requires huge infrastructure and requires the squid or the quantum sensors to be maintained at a very low temperatures. But in future we are going to get wearable sensors of quantum, where your watch, say this quantum sensor is embedded in your Apple Watch. You might be able to detect your pulse rate variability, arrhythmia detection, and heart rate variability in a much more sensitive way and predict the risk of sudden cardiac death of the future as well. Probably that might be there in the future. So with respect to drug discovery also, as I mentioned previously, the drug orientation can be determined easily by a quantum computer. This helps us in determining the way the molecule needs to be manufactured so that it can bind to a specific receptor in a much more easier way. As of now, we require tens of years or decades of time for a single molecule to be developed. But by probably the next decade, when we have quantum computers, you'll get an instantaneous pill based on your genomic data. This might be a revolutionary thing in the future as well. And the third thing is the digital twin, which our previous speaker was also speaking of. So a digital twin is nothing but a dynamic replica of yourself. So your whole data, the omic data, MRI, ECG, echo, everything is fed into the algorithm. And then a replica of yours is made. And everything is tested on it first. So say you have some fever and you have a molecule which is designed by quantum computer and given to the digital twin, and see how you're responding, in how many days you're responding, and whether you have some side effects or not. And then if it works well to the digital twin, then the pill is given to you. So probably this is one thing which is again a future thing. And we we also have evidence now that though not using quantum computers but with classical computers, artificial intelligent digital twins are made where a what if scenario is made. Say you have AF ablation which needs to be done. So 1,000 or 10,000 what if scenarios are made and check whether at a specific ablation, at a specific site, at a specific energy does prevent the trigger, and the electrophysiologist can just go there and ablate it without any side effects or complications. In the morning also, Ramesh sir also speaking of it, the CT FFR technology which we have now is a digital twin. You have your CT scan done to the patient, your model is made, which is a digital replica of yours, and then the hemodynamic parameters are embedded into it, which becomes your CT FFR, and then a virtual stenting on it can be done. This is being done by classical computers now, but in the future, quantum computer will do it with millimeter accuracy. The same thing can be done for your TAVI valves. You can just place them in the exact position and with millimeter accuracy and see whether there is any paravalvular leak or there is any rupture of the outflow tract and all before even doing it to the patient. The same thing for genetics and epigenetics. You know, genetic and epigenetic thing is one thing which classical computers never cracked, because there has been something called curse of dimensionality, because it's a huge data which classical computers cannot handle. The same quantum algorithms, few algorithms were developed like Shor's algorithm and all, which can sift through trillions of base pairs, trillions of permutations, combinations, and then decide what sort of genetic and epigenetic modification will help us in keeping the patient alive for 120 years, just like in the morning Dr. Anusha was discussing. So regenerative medicine, all these things are going to become much more easier once quantum computers come. Same with tissue engineering as well. You need to know how, at a quantum level, your scaffold interacts with the cells, how the cell members work with each other, how the ions move in a quantum way. Once you know all this information and once you're able to develop an algorithm where the mechanical stresses between the cells is known, so there will never be a problem in developing the model. Most of the time what happens in tissue engineering is you try to replicate an organ or something, but the initial cells don't attach with each other or die off because they don't have proper level of signaling. These sort of predictive modeling will also become much easier, and printing of heart might just be a cakewalk in the future. So having said this, all these things, then why is it not wide scale adopted yet? As I said previously, this requires huge amount of infrastructure, huge investment, and you require to keep these quantum computers at a sub temperatures of, say, in the level of 4 Kelvin, which is minus 269 degrees centigrade. So having such an infrastructure is one thing which is very difficult of, and second thing which is set is decoherence. So this quantum bits, which is qubit, need to stay in a coherent state. If there is some noise to it, it will decohere. So to maintain the coherence is still a huge challenge as of now, and scalability. As I told you in the beginning, our Amravati Quantum Valley is coming up with 133 qubits. Just imagine, this laptop which I'm holding now has trillions of bits. So when we are speaking of 133 qubit versus trillions of bits, we have huge way in quantum computing to go. Once we reach that mark of thousands or lakhs of qubits, then it is going to overtake everything, and they are going to be our future. So scalability still remains a challenge. Data integration with all the data which we have, which is derived from the classical computers, and integrating with quantum computing is one thing which we still need to sort out. And the final thing is something known as black box. Say if you have a aeroplane, and if it crashes, you might have heard that we collect black box from it. Black box is one thing where no information goes out of it or comes inside it. So even in the era of artificial intelligence also, people speak of this black box. So you ask ChatGPT one question, it gives you your answer. But sometimes we don't even really know whether it is hallucinating or it is really telling based on an inference which is biologically plausible. I get fever, it is because of malaria. I have a biological plausibility to it. But when you use artificial intelligence and quantum computing, they might give you such answers which you didn't even think of, which at least to our human brains is not biologically plausible. This is something called the black box phenomenon, because if you want a regulatory approval to something, it should be biologically plausible. So black box will still remain a hurdle for the quantum computing and the systems derived from it to get a regulatory approval. Once these things are navigated through, we are in the way of quantum era, and I think everyone will be using quantum computers, and everyone will be using specific applications derived from the quantum computers. We need not know all this physics. We just need to know how to use WhatsApp. Similarly, we just need to know the biospecific application derived from quantum computing. Certain things have already been developed, like Qiskit from IBM or Penillion for quantum machine learning. These applications will come in the future, and it will be just a cakewalk for us to deal a patient. For a patient or ourselves to live for 150 years, everything might happen, might not happen, but the way forward, looking at it, looks like it will happen for sure. If not in 10 years, probably in 20 to 30 years. One thing I just want to conclude saying, pondering upon is, I was speaking of quantum computers, but there is a speculation and theory that probably our human heart itself is a quantum device, and we might reach into such a level where we will know that heart itself works like a quantum device, and you need quantum computers to tackle a quantum device. It cannot be the other way. You cannot do it with classical computers. So that might be the way forward. Concluding, you just need to know a bit of physics, superposition and entanglement. In diagnostics, magnetocardiography is coming up in a big way. Digital twins in quantum classical computing is there now. With quantum computers, it is going to go in a big way. Drug discovery is one arena which people are hopeful for with quantum computing, and it might just cut down the period for drug delivery. Quantum machine learning and genetics are the future areas where quantum computer would shine again. Thank you.
Thank you to all the panelists, and thank